All right, everybody, thank you so much for being here with me today. Welcome to this webinar. This is going to be educational in nature. We are not providing any medical advice specifically to any individuals. This is blanketed information, lots of clinical data, and our real world clinical experience. Today's topic is why 80% of Americans could be on a GLP-1 in the next decade. We're going to take a look at the data behind the revolution. And the question I would like you to ask yourself is simply, am I resisting the biggest breakthrough or what could be the biggest breakthrough in modern medicine simply because I can't allow myself to believe that it could be this easy? And I really just want you to think about the theme of that kind of while we're going through the data here. Check in, ask yourself some questions. I am Danielle Lee Metz. I am a uh, clinical medical assistant, certified mental wellness coach, functional medicine and integrative health coach, and at Momentum Integrative Wellness, I go by the title Health Optimization Strategist, helping take your labs and your lifestyle from average to optimized. I like to say my career taught me how the system works, but my life taught me why so many people feel lost inside of it. Because I never wanted to be average, right? Ordinary, that just didn't fit who I am. I didn't want to be normal for my age. I always wanted the version of me that lived two standard deviations to the right of the bell curve, right? Like I wanted to be the outlier. I want to be the exception. Still moving, still sharp, still focused, still totally authentically me physically and mentally at 70, 80, 90, maybe crossing in to the centenarian lifestyle. Um, and I think growing up in the 80s, I'll kind of date myself there, for a long time, kind of thinking of those things felt a little strange to kind of want that and say that out loud. The people around me, the people that I loved, they weren't talking about longevity. They were sitting around the dinner table, the table at Thanksgiving or the big holidays when the family would all get together, and they were talking about their next doctor's appointment, their newest prescription, all the side effects, what was hurting today that maybe didn't hurt yesterday, the ailments, your aches, the pills, the pains, the waiting rooms, the doctors, all the conversations, the pharmacist, right? And I remember thinking like this just can't be the deal with getting older. Like I've just that doesn't feel right. It can't be what getting older is all about. They always talked about their wisdom, and I'm like, I don't care what kind of wisdom I'm going to gain if my body's going to fail me. So I really stopped watching them and I started looking around. I started looking for the healthy people. What were the people that actually lived a very vivacious life? The ones who had a lot of vitality. Like, what were they doing? The ones who were strong, they were energized. And you could tell it wasn't just by luck and by happenstance. They were absolutely doing something very different. They're doing something different physically, emotionally, mentally. Almost every one of them kind of led back to the same place. And for me, I really saw it a lot in the med spa world, anti-aging, longevity, peptides. And that's where I really started asking questions instead of just accepting this default narrative that getting older and it's just part of aging. I mean, how many of y'all been to the doctor and hear, oh yeah, honey, that's just part of aging? Or you're sitting there and you're the guy and you're going into the doctor and he's like, well, you don't, that's, you just don't have the testosterone of in your 20s anymore. Yeah, you have to loosen that belt buckle a little bit. Or, when you're talking about your hormones in the night sweats, that's just part of aging. I can't get rid of this 10 pounds. That's just normal. That's just part of getting old. Get used to it. And honestly, that question about what are these people doing? The ones that are active, the ones that are healthy, the ones that are not on a lot of prescriptions, they're moving around a lot. They look great. They obviously feel great. They're very energetic. That question is really the reason why momentum even exists, because our philosophy is very simple. We believe in prevention over prescription, unless that prescription is for peptides, for GLP, for BHRT, TRT, all the healthy things. And I'm going to take you through a lot of the data surrounding the GLP controversies that are out there because I challenge you, this is not a vanity metric. And there's nothing wrong, even if you're going into this with the initial mindset of considering it for you or considering whether or not looking better in your body and feeling better in your body is enough of a reason to take a medication. I mean, there's nothing wrong with having that internal check and balance to see, like, am I looking at it this through the correct lens? I think that's actually a good thing. Okay, so this is my prediction. And again, there's a lot of data that's supporting it right now. Within the next 5 to 10 years, you just might see upwards of 80% of Americans on a GLP-1. And truly, having seen the data, having looked at it, having been on one, having watched people's journey when they're on one, having coached many, many patients through how to optimize their body and be successful in recompensating their musculature while they're on a GLP, properly nourishing their body. I just believe it's the base case. I really do. Okay. How did we even get here? So let's go back and let's evaluate and examine some trends. Back in the 1960s, we looked at the CDC looked at adults that were classified as obese. And terms we're going to use is with obesity, having obesity, that are overweight, right? We're using, or with overweight, excuse me, because these are real medical classifications. And while many of you are on here looking and listening and researching for yourself, and you may not fall in the case of obesity, obesity is truly a thing. And we're really understanding now that this is not just a willpower, you're lazy, you have bad habits kind of a thing. This is a true metabolic disorder. But in 1962, only 13% of US adults were classified as obese. We jump 37 years later, and that number nearly triples. It goes from 13% in 1962 to 30.5%, nearly tripling in 30 years. That's a lot. Now, fast forward to 2020, about 20 years later, the last pre-pandemic wave, we're up to 42% just about. And today, this is the really, really sad part, right? And you can look around you and you can see it. 1 in 5 children, 20% of kids are classified as obese or classified as having obesity with overweight. That's tough, right? We see that the, you know, American motto, bigger, better, faster, more, now. We work 60-hour weeks. We don't have the proper work-life balance. We're getting things on the go. We're not fueling our body properly. We're still ingrained that hard work is the only way to achieve blood, sweat, tears, and sacrifice, that typical 1950s mantra, everything in life, right, that's worth having, it requires really, really hard work. And these are the things I'm challenging you on. These are the narratives that are ingrained into you that you've heard for generations, that I'm saying it does not have to be the case when it comes to your physiology. So let's kind of look here at what the causes of weight gain, over obesity, overweight truly are, right? And there's a whole lot of things that go into that, and we're going to go a little more in depth in some of these and maybe not all of them. But it's not so much a willpower story. It's what I just alluded to, right? This is truly a metabolic or genetic disorder, having obesity. And we see these hormonal shifts happen as we naturally age. So we're going to examine genes and epigenetics. We're talking about different hormonal shifts. What about your environment, right? People who deal with, and this is where the "it didn't crush me" mantra really comes from, right? That is my trademark. Um, and I wholeheartedly believe that resilience is a finite state that's meant to get you through the hard shit in life, but it's certainly not a place where you want to live. Resilience is not something that you want to wave around like your busy badge. And you know, those people, you know what I'm talking about when I say busy badge. Resilience is not the place you want to live for an extended period of time. You don't want to have to constantly overcome because that puts you in these periods of chronic prolonged stress. Now, my marker is once you've come out of that period of chronic prolonged stress, it's going to take you a solid 3 years to release that from your body if and only if you're doing things to actively work to release it. If you are not even mindfully working to remove this elevated level of stress, trauma, cortisol from your body post-traumatic moment, it's going to take hold and you're going to continue for a period a lot longer than 3 years to experience the symptoms from that chronic prolonged stress. Traumatic moments, again, this tends to be, it can be short and intense, but they can also turn into those long chronic stages. Then we're dealing with the food supply and changes, right? The modifications that have really happened in our food supply. And we're going to talk a lot about that today too. And then you're dealing with endocrine disruptors. We're seeing ads for underwear now that, better quality cotton, organic, so that we're not putting all of these plastics and toxins on our body, which are truly changing the testosterone or the hormone levels in our children at very, very young ages and which then has a cascading effect into adulthood. Then we're, on as well as aging, metabolic changes, medication, lifestyle factors, right? So one thing that to kind of bring your attention to is when you're dealing with these genes and epigenetics, the amount of in utero stress that you deal with, right? Your mother's weight, how much transgenerational trauma is happening, that's going to have a huge effect on the baby's um, metabolic system and whether or not they will be overweight or be classified as having obesity. You've got multiple hormones that are going to affect your weight. You've got insulin, leptin, cortisol, ghrelin, your hunger hormone, estrogen, testosterone, your thyroid, T3, T4, peptide double Y, and GLP-1. These are all things that can cause weight gain, fluctuates in these hormones. Um, Insulin resistance, obviously, PMOS, or formerly known as PCOS, hypothyroidism, Cushing's syndrome, which would be excess cortisol, low testosterone. Low testosterone is also correlated to obesity, overweight, weight gain that you can't get rid of. And then, of course, we have lifestyle factors that really go into this, bigger, better, faster, more, our disproportionate work-life balance here in the United States, sleep, stress, your season of life, recreation or alcohol and drugs, your work, all of these things play a huge, huge factor into your causes of either weight gain, obesity, or overweight. So let's kind of talk about the environment that changed. Margarine was initially developed as a direct response to military challenges, right? Finding a high-fat, shelf-stable, and inexpensive substitute for butter to sustain soldiers in the field is really kind of where margarine came into play. And while it gained mass and popularity during World War II due to butter rationing, its military origins date back nearly 75 years even before that. So let's kind of look at like what was going on in the military and the benefit and why this margarine was really created, right? So the Emperor Napoleon III of France back in 1869, he's truly the one who commissioned the creation of margarine. He offered a prize for some form of like socially acceptable fat that could meet the needs of the French Navy and Army during the Industrial Revolution. Unlike butter, because butter would spoil very, very quickly, and it was difficult to manage in extreme temperature swings, right? Too cold, very hard, too hot, melty, up against your body heat, melty, uh-oh. And so then oleomargarine hit the market. It was really designed for like a superior quality so that it would be more shelf stable, resist more of those high fluctuating temperatures, less sensitive, obviously, to cool and heat, making it depressingly suitable for the harsh industrialized conditions of modern warfare. Maintaining the energy levels in soldiers was paramount, right? In later conflicts like World War II, synthetic versions, including a coal butter developed in Germany, could contribute as much as 700 calories a day to a soldier's diet, providing critical energy that they would need for combat. And butter was expensive and difficult to ship overseas. During World War II, German submarines frequently torpedoed shipments of butter that were bound for Allied troops, whereas margarine, it was so much cheaper to produce and easier to transport in bulk. Then became the shift of industrial oils. We shifted to an omega-6 rich base or diet. The widespread adoption of margarine during World War II marked a permanent shift in the American diet from an animal-based fat to vegetable-based oils. And one of the things that we commit to at Momentum Integrative Wellness is optimization of your omega-6 to 3 levels. And I'm not sure if we'll have time to get into that, but obviously, if you have questions, I can answer those for you. But your omega-6, it is an essential fatty acid. Your body needs it. It doesn't make it, therefore you must take it. But your omega-6 levels in today's world are way, way too high. And this is an inflammatory um, fatty acid. And we often are dealing with chronic inflammation as a society, which is the root cause of so many chronic diseases. And if you can reduce chronic inflammation, you're going to reduce significantly your propensity to develop these chronic diseases and or potentially reverse many of them. So as we were dealing with this transition to vegetable oils from animal fats, the early margarine was using beef tallow, but obviously during the World Wars, manufacturers switched to hydrogenated vegetable oils like soybean and cottonseed oil. The shift is often cited as the historical turning point that introduced those high levels of, like I was telling you just a minute ago, pro-inflammatory omega-6 fatty acids into the food supply. It was contributing to the 10 to 1 to 20 to 1 omega-6 to 3 imbalance that is discussed heavily in modern brain research, right? So real quick, omega-6, we just talked about it's an essential fatty acid that your body does not make, therefore you must take it. And whatever level you have of omega-6 in your body is wholly indicative of what you have taken in. The same thing with omega-3. Omega-3 is an essential class of fatty acids. Omega-6 also a class, not just one. You have 11 different essential fatty acids in your body, PS. Omega-3, omega-6, omega-9, and and a few others. I think omega-9 has two, omega-3 has three, and omega-6 has three or four, and a couple others, right? That makes up your 11 different fatty acids in the entire profile of them. But the ratio that you want, right? Because omega-6 is inflammatory, and that's important. You need to have an inflammatory response for illness, for pain, for acute injury, for protection, but omega-3 is anti-inflammatory. The ratio between those two is 3 to 1. Also, and I love, this is one of the things I also geek out on, right? I love science and I love the body and I love biology, is um, that 3 to 1 ratio is going to indicate how healthy your cellular membrane is. And it's going to tell you how permeable your cell membrane is. If the membrane, and this goes back to, like, I don't know, third, fourth grade science, maybe, that cellular membrane needs to allow signals to enter the cell, and then it can work on the signal. And then it also needs to be able to dispel those signals or release the toxins. So it really comes down to nutrient absorption, cellular signaling, cleaning out the toxins from the cells. So if that cell is too rigid, the permeability isn't there. If it's too soft, permeability isn't there. So we really want that number to be 3 to 1 or less. The average American right now sits at 25 to 1. That's more than 8 times an acceptable level. But that's due to this industrial seed oil revolution. And so when you're looking at the environment of which our food supply has changed, and if you know a farmer, if you know somebody who's been a farming family, the nutritional content of a carrot today is nothing compared to the nutritional content of a carrot in 1950. The dang things don't even look the same. They're not normally straight. They used to be lumpy and curvy and not perfect. Now carrots look absolutely perfect. Why? We've genetically modified our seeds. We've changed how we plant crops. We've modified, the wheat modifications We are, instead of growing it during one season, we've changed those seeds to become grown 24/7, which has caused many, many intolerances to gluten and such. We've ruined our food supply, people. That's why we are so focused on wellness here at Momentum and being able to do things to reverse inflammation and increase the health of our cells and cellular signaling and reduce oxidative stress. I mean, the three things that are going to contribute to negative energy in your body are going to be mitochondrial dysfunction, oxidative stress, and chronic inflammation. And if we can start to handle or employ some strategies to change that, you will begin getting healthier, and those body systems will have a positive effect on all the others throughout your body. So, going again back to kind of like this prevalence and how we got here, we talked about, again, I'm just bringing the data back from 1962 at 13% of the population back into 2020, dang near 50%. And those numbers just kept growing. I think I watched a documentary recently on The Biggest Loser. And as when that show came out, even with knowing all the things that were happening and really bringing an awareness to obesity and being able to do things and how you can make changes in your life, the obesity rate continued to climb. And so we don't just want to make this about self-blame and saying that you're lazy and you're just the product of your poor choices. That's a part of it, but it's not the whole story. And I want you to hear that wholeheartedly. You can be doing so many of all the right things, and I know many of you are doing so many all the right things, and you're not seeing changes in your body, and that's because metabolically your body has hit a dysfunctional place. 93% of Americans are suffering from some form of metabolic dysfunction. Once you hit midlife, you are already dealing with insulin resistance because the older that we get, we become more and more insulin resistant. Insulin sensitivity is something that can and we can restore through the use of, excuse me, GLP-1s, diet, lifestyle, exercise, all of the things, right? And so, how is BMI is the thing that has always been used to measure your level of health, your obesity. And it's highly, highly inaccurate because it doesn't take into account anybody's musculature, their bone build, or anything like that. I have teeny tiny bones. My husband has very big, thick, dense bones. He's built like a brick. I'm teeny and tiny. He would classify as obese, even though he has very little body fat, just because the system is outdated. BIA, bioelectrical impedance analysis, is probably one of the much better markers for how we test this, right? So, what we're looking at in terms of measuring obesity, we're going to look at things like CRP, C-reactive protein. We're going to look at interleukin 6. We're going to do a test like that, right? And it's often ordered alongside HSCRP and homocysteine as part of your inflammatory panel. It is something that we run standard on all of our new patients at Momentum. Um, but interleukin 6, it's used to assess the degree of systemic chronic inflammation. And when you're using this, it's more sensitive for detecting this earlier kind of subtle inflammation. That is not one of the markers you need to run right off the bat. It's a lot more expensive test. And if other things come, if homocysteine comes back fine, if your HSCRP comes back fine, your omega-6 to 3 ratio, I guarantee is always going to be off. I've yet to have one person. I think my best client who had taken an omega-3 fish oil of some sort pretty consistently for years. The best I've seen is 7 to 1, which is still out of balance. That's not where you need to be. So there's lots of tests that we can run. We're going to look at your metabolic health markers in terms of fasting glucose. Fasting insulin is almost never run, and it is something that's important to run. We're going to look at HbA1c. We're obviously going to assess your lipid profile, but then the body composition comes in. This is where we're going to assess visceral fat, bone density, fat mass, muscle mass. And yes, a DEXA is great. And many people don't even know you don't have to wait for your insurance to cover a DEXA scan in your 60s. You can just go locally and pay for one. Usually the test will cost you between $100 and $200, but it's a great baseline measure. MRI is super obnoxious. I mean, who loves to go sit in a big MRI machine, right? And then a bioimpedance analysis, that's what we use right in our office to give you a look at all of these numbers. The other thing that's really important to assess is your waist to hip ratio and your overall waist circumference. Every 10 centimeters increase in waist circumference is going to give you an 11% higher chance for all-cause mortality. That's every 10 centimeters. Then if you are, so that's about just under 4 inches in increase in your waistline. How many people's waistline has increased 4 inches since COVID? I mean, really. But then when we're looking at this waist to hip ratio, that's even more lethal, right? If you're just moving, if your ratio is changing by just 0.1 unit, that can be associated with an increase in a 20% increase in overall risk of death. So women, your circumference waist circumference needs to be less than 35 inches, whereas men, you want your waist circumference less than 40. And again, this is not ideal. This is just to mitigate risk factors for all cause mortality down the road. Here we go. Now we're really getting into the meat and potatoes, and I love this data. GLP-1s have become one of my favorite medications. And I will tell you, a few years ago, I was absolutely unequivocally hell bent against them. And I will tell you, when I had that impression, I had done none of the data. I had not looked at any of the data. I had done none of the research. I was just listening to headlines, and I was still going back to that same old adage, if it's too good to be true if it's really that easy, right? Everything worth having comes from blood, sweat, and tears and sacrifice. That was really what was ingrained in me, and I didn't even want to look at the data. But what is a GLP-1? So GLP-1 is a naturally occurring hormone that your body already makes. It is released the moment that food hits your mouth. It's going to signal fullness and it degrades in 2 minutes. So when you see some of these ads saying increase just your natural GLP-1 naturally and you'll lose weight, that is bullshit. I'm telling you, it is bullshit. Your body's GLP-1 is absorbed and gone in 2 minutes. That is not a long enough time to sustain weight loss. So how did GLP-1s come about? Well, Dr. John Eng identified a compound in the Gila monster venom that mimicked GLP-1, but it didn't break down as fast in the body. This later became exenatide, which was Byetta, the first drug in the class. Insurance didn't want to cover it at first. There were much cheaper diabetes options. And remember, these were diabetes medications long before they were weight loss medications. How does it work? This is the most simplified way, right? This quote right here. Traditional diets teach you to fight your body into changing. GLP-1 medications create the conditions that make change easier. If that's the only thing you take away from this webinar today, that's what I want you to hear loud and clear. Traditional diets teach you to fight your body into changing. GLP-1 medications create the conditions that make that change easier. How do they work? It's really simple. It's three basic mechanisms. They're going to slow gastric emptying. They're going to signal satiety, meaning they're going to say, hey, you're getting full. Don't eat anymore, which is going to be done by increasing peptide double Y, so peptide YY, and decreasing ghrelin. Ghrelin, I told you, is that hunger hormone. And it's also going to act on GLP-1 receptors in your brain, sitting in the amygdala, that quiets that food noise. This is kind of reducing that reward-driven eating of, of this, oh, tastes really good. Your brain, you have that bite of ice cream or you have that bite of cake or you have that really delectable savory pasta sauce. And your brain's like, oh my gosh, give me more, give me more. And you find like you can't stop that. Well, the GLP-1s quiet that food noise by hitting the GLP-1 receptors in your brain. Once you've been on a GLP-1 for about 90-ish days, oh gosh, neuroremodeling has taken place and you don't have those same associations anymore. So really, once you get past that first 3 months, it's a whole different ballgame. And quite honestly, we hear people experience in their first couple weeks. We'll hear things, patients say things like, I can't tell you how many hours of my day I have freed up because I'm not thinking about my next meal. I'm not thinking about what I should be eating. I'm not thinking about what I could be eating. I'm not thinking about what I want to be eating but can't eat. I'm not, I just have so much time for the things that matter and the creativity because I'm not spending my day wrapped around the axle around the grocery store in my head. And that's a fact. You find also, and this is what I wanted to bring up, if we're looking at insulin resistance by age bracket, people are in their 18 to 44-ish year, about 40%. Once you get into the ages 40 to 60, you're looking at 67% of the population is dealing with insulin resistance. Or if it's not full-blown insulin resistance, right? Because that's a classification number, you're dealing with the loss of insulin sensitivity, you begin moving toward insulin resistance, even if you haven't fully adopted it yet. And once you're over the age of 75, over 75% of people are dealing with insulin resistance. And so getting diagnosed with diabetes, it's about 25%, 30% of the people over the age of 65. These medications have been absolutely life-changing to help control the diabetes, and when you catch it early enough, completely reverse it. All right, so this is where we're getting into a lot of that data that most people have not seen. We are going to go very high level. It does not need to be a deep, deep dive here, but I think you're going to see that these are the things no one is talking about right now, and these are the things that matter. The cardiovascular system is so, so important. Cardiovascular disease is a huge cause of all cause mortality in the United States, number one killer of women. 20% fewer heart attacks in strokes, or heart attacks, strokes, and cardiovascular deaths, excuse me, in patients without diabetes from taking a GLP-1 in the SELECT trial. This trial is literally this is the trial that moved these drugs from being a weight loss medication to true cardioprotective therapy in the terms of like how physicians are talking about them. Excuse me. This was a randomized, double-blind, placebo-controlled. That is the gold standard for study design. Over 17,600 adults, all with existing cardiovascular disease and overweight, obesity. The fact that none of these patients had diabetes and you saw this positive of an effect on them from using semaglutide, the 2.4 milligram dose, that's a higher dose, but that is a diabetes dose. Primary outcome, composite of heart attack, stroke, and cardiovascular death. 20% relative risk reduction published in the New England Journal of Medicine. Now we're going to see that you have significant and real relief from heart failure symptoms in the STEP-HFpEF trial. Also looked at semaglutide on heart disease and stroke in patients with overweight and obesity. It was a full 52-week study, so that's a year. Also published in the New England Journal of Medicine back in 2023. These significantly better symptom scores with greater weight loss and improved walking distance versus placebo, that's huge. Patients who've dealt with heart failure to improve the amount of walking distance and help improve their overall weight, significant. This is discussed a lot of times when we are talking about the older patient population. Renal failure is something that pharmacists, doctors really want to watch. The older you get, you typically have less and less kidney function. When these patients in the FLOW trial, they did have type 2 diabetes And obviously, kidney function is very important to monitor in type 2 diabetes. There's a 24% reduction in kidney disease progression when taking GLP-1. And I believe this was, yes, also semaglutide or Ozempic. 18% reduction in cardiovascular events. Also huge. Also published in the New England Journal of Medicine. Sleep apnea, we know this is a real big one as well. Who loves to sleep with that mask or sleep next to someone with that mask? I mean, dear God. And what you're seeing in the Surmount OSA trial is that there were 63% fewer sleep apnea events. There has never been a CPAP machine that has produced a 55 to 60% reduction in apnea events on its own, period. Read that again. There's never been a CPAP machine that has produced robust results like this on its own. So think about how cumbersome it is to put that sucker on and sleep with it at night, or how annoying it is to sleep next to it. And you're nodding your head, right? If your husband or your wife wears one of these, but it's important. When taking tirzepatide over this 52-week trial, 1 year, this is not insignificant. And we're also dealing with this is about 469 patients. 63% fewer sleep apnea events. That's huge. The patient population was obesity and moderate to severe um, obstructive sleep apnea, up to 15 milligrams weekly tirzepatide. So that was the full dosing range versus placebo. There were two parallel trials that went on here, one for patients not using CPAP, and one, so right, they looked both at patients who were not using CPAP and just put them on tirzepatide and monitored the sleep apnea events. And then they also looked at patients who were on a CPAP already using the PAP therapy, and they put them on tirzepatide and saw the reduction in overall sleep apnea events. Huge. Also published in the New England Journal of Medicine. This one kind of sounds like a no-brainer. It makes sense, right? You reduce overall weight, overall burden. You should then, in respect, reduce pain. But they studied it in the step 9 with a WOMAC pain score. They validated an osteoarthritis pain / function scale and body weight. 68 weeks, so farther than a year. What is that, a year and 14 weeks? A little over 13 months. 16. No, a year and 4 months. Um, Now, granted, they're not going for an FDA indication for osteoarthritis, but what you're seeing is that significantly reduced pain with patients who have knee osteoarthritis. This is very typical. We see this in patients getting older in general. Um, Huge benefit. I will say that when it comes to autoimmune disease, real world experience, we have a very, very positive effect on autoimmune symptoms. But in terms of true hardcore evidence, I would say this would probably be the softest um, evidence in this section. Patient reported symptom relief. As these medications reduce systemic inflammation, it's often first weight to come off is that inflammatory weight. But in autoimmune patients, we are dosing very, very cautiously. We're titrating very, very slow so that we want the body to assimilate when we're putting these medications in their system. And as long as you go low and you go slow, people tend to have a very, very positive effect, right? So you're seeing patient reported and observational reports of fewer flares in psoriasis, rheumatoid arthritis, lupus, IBD among GLP-1 users, right? Um, there hasn't been a large randomized trial, but these are self-reported observational reports, but there's a large body of evidence out there. And so kind of what they're hypothesizing here is that that gut immune access modulation is happening with GLP-1 utilization. Again, it works in your gut, right? We're targeting those GLP-1 receptors in your gut. Also has a systemic anti-inflammatory effect and also has a positive effect on the lining of the gut. We know many gut issues or autoimmune issues begin in the gut. 30% lower risk of breast cancer. This was observational data. So this was data that was presented by Dr. Elizabeth McDonald. She was at Penn Perelman School of Medicine and the Abrams Cancer Center. It was a retrospective cohort study, so it wasn't truly a randomized trial. We're just looking at the data that's there from that was built from these EHR records from patients being treated. But I want you to hear this. 111,646 women, right? They were aged between 45 and 80, all had a BMI of over 25, and they all had breast imaging with a documented outcome between January of 22 and June of 25. 13.7% of them, that was the 15,264 number on here, had a documented GLP-1 prescription. The results showed that 35%, or the patients had a 35% lower odds of breast cancer in that full analysis. Something else that I want to kind of bring to light, and it doesn't make it here in the slide deck, but there's studies going on in mice models right now, and what they're seeing in studying tirzepatide, which would be branded Wegovy in terms of the weight loss indication, it would be branded Mounjaro in terms of the diabetes indication, same exact medication, two different brand names for marketing purposes to separate the two categories for what they're properly being used for. But this is the dual agonist, right? GLP-1 plus GIP. We're seeing in these mice models a 24% reduction in breast cancer tumors. Again, it's mice, but it's positive data. Here we're looking at just, again, more observational data, just under 850,000 patients with a breast cancer diagnosis, retrospective study. They're seeing that the women who were already on a GLP-1, they were 50% less likely to progress to stage 4. This is some Cleveland Clinic data. We're also seeing, and this is also what we see in our practice, and you may hear this, GLP-1 patients, when they start their medications, tend to lose their appetite, their hunger for alcohol. Maybe not in totality, but maybe a couple glasses of wine at girls' night might only be one. Or some patients are discontinuing alcohol use. We often find in clinical practice when a patient has a history of alcohol use disorder, addictive tendencies, past drug use, they tend to do well on semaglutide over tirzepatide. You can try either, but typically I would say semaglutide tends to be a little bit more of a better benefit here. And right now they are studying semaglutide alongside, I want to say cagrilintide. Don't quote me on that. In changing this brain's reward loop and seeing if they could potentially come out with an indication for reduction in whether it's alcohol use disorder, addiction, what have you. Again, these trials are underway, but they're nowhere near being complete, so to be determined. But it's because real world data exists where people are seeing a reduction in their hunger and their thirst for alcohol and drugs, which is also leading, right? We're creating an environment that breeds ground for healthier behaviors. So the common thread here is we're really talking about chronic inflammation, because that is the thing, is the underlying foundation of most chronic disease, chronic inflammation. And that's why I'm saying when we can handle and get under control chronic inflammation in the body, systemic, cellular, all the different types, it's going to be a lot harder for those other disease states to take hold. And so what you're really seeing across nearly every one of these trials is the benefit shows up independent of just weight loss alone. CRP and these inflammatory cytokines, they all drop. This goes right back to me talking earlier about the metrics, why biology is one of the reasons, and the hormone pathway that touches your heart, kidneys, joints, brain, and now cancer risk. And all of these things are positively affecting them when you are starting GLP-1 therapy. This is why I truly just don't believe that it's hype anymore, right? When one class of therapy shows benefit across heart, kidney, joints, brain, reward pathways, and now cancer outcomes, independent of your diabetes status, the addressable population stops being just people with diabetes and truly becomes most adults. That's why we are using this as a significant and strong longevity tool. Most of our patients, right, because we're a wellness clinic, we believe in optimized over average, right? Most of our patients aren't coming in because they're sick. They do kind of start in that class of vanity metric. They're like, I'm tired of looking like this. I'm tired of feeling like this. I'm tired of settling for the midlife slowdown fluff and puff, and they want to do something about it. And they've done the I've tried at the gym, I've been calorically restrictive, I've tried to count my macros, I'm trying to eat nothing works, right? There tends to be a hormonal imbalance there that we need to address. There's definitely metabolic dysfunction happening and moving toward that insulin resistant space. And it's really why we believe, and our philosophy at Momentum Integrative Wellness is that we test, we don't guess. And so, how our care model works is we start out with a in-depth lab review. We are assessing upwards of 70-ish different biomarkers. We're looking at your metabolic panel. We're looking at lipids. We're looking at cardiovascular panels. We're looking and assessing those inflammatory markers. We are looking at your hormone levels. That's going to play a huge part in this. We're looking at liver function. Um, there are, again, this is such a beautiful baseline because there's nothing worse than wanting to make a change to medication, a couple or peptides, right? Or your peptide protocol down the road and go, gosh, I really don't know what my baseline was. So all of our patients come in with a comprehensive consultation and lab review. It takes about 2 weeks, honestly. So what you do is you call in, you let us know whether once your labs drawn through LabCorp or Quest, go ahead and you pay for that consultation. We send your lab order over, and during that 2 week time period, we're going to send you a very, very comprehensive intake. Because we're more in the functional wellness space, prevention over prescriptions. So we're going to look at the season of life that you're currently in. We're going to look at your health goals. We're going to ask you what's been going on physically, emotionally, mentally for the past 3 to 5 years. We want to know like what you want your life to look like in a year and maybe again in 3 to 5 years. We want to know what season you're in. Are you in your sandwich years where you're taking care of your aging parents, but you've also got children at home? Are you working? How many things are you juggling? Do you have a high stress job? What is your level of health stress? We're looking at all of those things so that then once those labs come back, we're having a very targeted and specific conversation about a protocol that's going to move the needle, right? That's going to take your labs and your lifestyle from average to optimized. And it's not just a generic conversation where we're citing data. We're citing your data and we're talking about measurable health outcomes. And the things that, a couple things we like to focus on, yeah, they are vanity metrics, right? We want to talk about your waistline and your physique because there is nothing more frustrating. And I know, men, you feel this way too, than trying to go to your closet and just having to get something out and knowing that these clothes are old, they don't look the greatest on you. You don't want to go spend any more money on new things when you feel like you just kind of look soft and sloppy, but yet everything is on the line when you're presenting at work or you're in front of a client with a contract, or you're walking into a room and there's other very fit, energetic people, and you just know that your physiology is telling them a story that you're not that healthy right now. And that affects your confidence, that affects your swagger. And ladies, when you're trying to get ready for girls' night or just whatever it is for work, it's exhausting, right? And there's no better feeling when you go to the closet and you start to realize your clothes are now too big for you and you need to go shopping again. But these things also very much spill over, not just from the boardroom, but right into the bedroom. And I think we as a society, in our midlife years, when we are transitioning from all of that hot, young energy, looking so great in our early years, into this busy, responsible these sandwich years of life, and you feel like everyone's just told you, well, that's just your body changing. You kind of have to let things go because you don't have time to keep up with all the blah, 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 blah. One of the things that tends to go too is that intimacy, right? When you don't feel confident in your body and your body is letting you down and you can't perform sexually, or you feel dead inside. You know, when I say those words, I just feel dead inside. You know exactly what I mean. That intimacy is gone in your relationship. And those are the things that start to tear people apart. And those are the things that we have, those are conversations we have with our patient. Because when you start to feel better in your body, and your body begins to respond to the foods that you're eating, it begins to respond because naturally what happens is once you're on GLP-1 therapy and some of that inflammation starts to dissipate and you start to feel a little bit lighter in your body, you have more energy. What do you typically do with that energy? You start moving your body a little bit more. So now here's that environment, right, that we talked about the GLP-1 creating, where now you're like, you know what? It doesn't feel like I'm banging my head up against the wall because if I go to the gym, like the weight is kind of starting to come off, but I'm feeling lighter and I don't really have so much joint pain. Let me go to the gym because now I'm excited to see, like, watch my body begin to change. It's the same thing that we help you with in the bedroom at home too. When your body is not responding and the sexual desire is not there, the stamina, the performance, you feeling dead inside, nobody wants to roll over next to your husband or wife and feel like they're not keeping up their end of the bargain or wincing because, oh, my husband's going to touch me tonight and my body doesn't light up anymore. And I got to sit here and try to fake it because I want to be a willing participant because I love my husband, but there's nothing going on here. Or you lean over to touch him and his body is not responding, right? Like these are things that really tear couples apart. And I think there are conversations that need to continue to happen. And we need to normalize like prioritizing sexual wellness and health and vitality in our marriage, in our relationships. Because there's nothing better than showing your children and your kids what healthy relationships look like. You don't want your children to settle. We all want better for our kids, we want for themselves, but we have to show them what what they're not going to be willing to settle for. Oh, and again, when we talked about these specialties kind of right here, right? Number one, metabolic health recalibration. I don't care whether we're talking about taking back your body. We call it the reclamation. We can call it whatever you want. It's a true metabolic reset, and we can usually do that in the first 3 months. Our programs are 3, 6, and 12 months long. We're going to talk about hormone optimization. Sometimes we're going to do hormone optimization with a metabolic recalibration all at the same time. That's going to be a minimum of a 6-month program. Ideally, I like to see patients in there for a solid year. We have gut health harmony that we deal with, right? Gut health is the core of autoimmune disease, anxieties, and then a lot of restorative health protocols. This is where we love to use peptides for regenerative health, um, recovery from orthopedic surgeries, movement excellence. Like we live in Florida, there's a lot of pickleball, tennis, golf going on. And you don't want to take so long getting out of bed in the morning being stiff. You want to play 4 matches of pickleball on Saturday and you darn well want to do it again Sunday morning. And so it is our job. What we do is we help you recover faster so you can play harder and train smarter. Um, Obviously, and then we do these advanced longevity protocols where we're dealing with mitochondrial enhancement and lengthening of your telomeres. And we talk about sleep and we can enhance your sleep. I mean, sleep is your secret weapon to healing your body. And when you hear people say, I can sleep when I'm dead, that is such bullshit. We do not want to do that. You need to restore and heal overnight. And a lot of people have true sleep deficiencies and sleep deprivation. We can help you make those changes. And obviously, anti-aging and aesthetics, we deal with both biostimulars, Botox. When you're changing your metabolic health profile, um, your skin changes. And we want to do things proactively and preventatively to keep the elasticity, to keep up the collagen, to stay healthy, to look, to still have a full and supple cheeks, but minimize those fine lines and wrinkles. And so we are your one full stop shop for all of your anti-aging and longevity needs. Stephanie Tippett, she is our driving nurse practitioner. She and I co-own Momentum Integrative Wellness together. She is Miss Bella Rose. She does own one of the largest and most successful medical spas in the state of Maryland. She has a plastic surgery center within there and many injectors working underneath her. We also have another nurse practitioner who works with our hormone optimization program as well. And I cannot stress this enough to you. You cannot access peptides without a prescription or approval from a licensed medical professional. If you're able to add to cart and order them on your own, they're going to say on the side of the vial, not for human consumption. And I strongly urge you not to use and inject those into your body. The biggest mistake I see people make, honestly, is taking too many all at once, not properly cycling them, and overloading the body with signals that are either not in the right order or just are kind of canceling one another out. So why waste your time and your money, right? When you have a medically guided protocol that is precision developed for you, again, based on your labs, because we're not going to guess, we're going to test, then we can assure you that you're not throwing your money down the drain, right? Sometimes less is more. Sometimes more is more, but it's better to know that you are being prescribed them from a medical professional who understands cycling, signaling, and how you can get the most out of your peptide protocols. So that is me, Danielle Lee. I do go by my last name, Metz, in the office, but on socials, you can find me at Danielle Lee, hashtag it didn't crush me. Our website is PeptidesStuart.com. That's peptides with an S, STUART.com. Also Peptides Jupiter, Peptides West Palm Beach.com as well. Thank you all for being here with me today.